To plan where to inject, I'm following the contour of the cheekbone called the zygomatic bone on the side of the face all the way around to the front. You can then see that it stops part way because of volume loss from the aging process, and the apple of the cheek has been slightly lost around here. My injection point markings represent where I want volume so that the zygomatic bone flows nicely into the apple of the cheek at the front once more for a smooth contour all the way around from side to front. In fact, look at yourself from the side profile and see if this section here is curved forward, flat, or something else. What we naturally find attractive is some sort of soft curve to the front. And the flatness that we have here in this case is what I'm trying to reverse both in this treatment and future treatments as well, slowly over time. My needle is then going perpendicular and deep to the bone, because if you place filler very shallow or superficial in this region, then when the patient smiles and muscles contract, then the filler on top of it, which is shallow, is going to bunch up and poke through the skin to look like there's a tennis ball inside or something. So always go deep and underneath the muscle here to avoid looking overfilled when you smile. Each point is around 0.2 mil, but it can vary based on how much volume loss there is and the quality of the patient's skin. I've used Reveness Shape again here, simply because it's just such a brilliant filler, and I'm not being paid to say that, by the way. I have practically no swelling whatsoever when I use it, so what you see on the day is what you get. And because the particles are completely spherical, as I'm sure I've said before, even a thick filler like this, which is mimicking bone, is very, very easy and smooth to inject, which makes it much easier for me to use and the patient's more comfortable while I'm injecting as well. I've used in total about 1.2 mil across both sides here, but we'll probably add more in a month or so to keep going and improve the result even more. To stay looking natural and not overfilled, I always recommend my patients to inject over a long period of time if they're worried of looking unnatural, and to do a little bit each time. Alternatively, even if a patient needs a lot of filler in one session, like 6 or 8 mils or more, then that's actually okay as well. It doesn't necessarily mean you look overfilled just because you use a lot of filler. It's how you use the filler rather than how much you've used.